Hi everyone, in this video I'm going to show you an example of odontoma. So this patient is in his 20s, and if we look toward the anterior mandible, should we start out with this one? So let's go ahead and open this one. Here we see mandibular incisors, and right over the apex of this incisor number 26, we see that there's kind of mixed density lesion, right? So let me see if I can adjust the contrast to bring out its border. You do see a radiolucent rim about here, right? As best as you can, that's probably where it ends. I can draw all the way here, but I'm not sure you can confidently see that, and that's better visualized on the other view. But I hope you can at least trace this radiolucent rim, and internally it has kind of wide range of densities, right? Some areas appear very radio-opaque, and some areas there's some lucency, and so there's a kind of mixture of very opaque area and radiolucent areas. So let's take a look at the other view, and hopefully this is more clear. So when we look at this, we see that this lesion or entity is located kind of between the incisor, lateral incisor, and the canine. And if you weren't able to see it before, hopefully it's relatively clear that we see this tooth-like structure, where this is the coronal or crown of that tooth, and then this is the part of that root. It's definitely much smaller, right? But it has overall shape of a tooth. And also enamel radial density of this part is more radial dense than the rest of the tooth. However, if you look at this, while it still has that kind of elongated shape, it certainly doesn't quite look like a normal shape of a tooth, right? So it has this kind of malformed appearance of a tooth. And we see some radiolucent component possibly here, and the kind of denser areas. So this is an example of odontoma, specifically compound odontoma. And let's see, what else could I go over? They reach they develop typically around the second decade, and I expect this is fully mature, meaning I don't expect this to continue to grow. Typically when the patient reaches the skeletal maturity and all teeth have been fully erupted, then that's about the same time this will also fully mature as well. And just because you have this doesn't necessarily require them to be removed, if especially it's not damaging any surrounding tooth structures. So it's unclear to me whether it's causing root resorption of the canine or not. I do see the outline of the PDL space, which looks pretty normal here, but I can't tell for sure whether there's a resorption on the buccal or lingual side. But most importantly, I see that teeth have been erupted, and I really don't see a reason at this point to extract this. However, say this odontoma was located toward the alveolar crest such that it was blocking the eruption of the permanent canine, and in that case it certainly needs to be removed. But I just want you to see an example of odontoma. Let's go back to this one again. If we look over to the other side, this area is has that kind of diffuse radial opacity, and that is consistent with mandibular tori. So I just want you to be able to recognize that. Thank you very much, and I'll see you in the next video. Bye.